So today we're going to be talking about the Community Mental Health Transformation Programme, and that's part of our mental health programme across the whole of Staffordshire and Stoke-on-Trent, but it's focused specifically on our community mental health services and how we can change them over a 3-year period to make them more accessible, better for service users in terms of being able to navigate them and get into the right place, the right time. The programme is going to be running over a 3-year period, and that's from April 2021 through to the end of March 2024. And what that's going to be able to let us do over that period of time is to expand our mental health services within the community, but also invest in things like the voluntary sector and other areas of support for patients, so that we can make sure that services become more accessible. As I've said, it's a 3-year programme and it's going to be operating across the whole of the STP over that period of time, the whole of Stoke-on-Trent and Staffordshire. And we're working very closely with the voluntary sector and with our local authority colleagues to make sure we get the biggest impact whilst we do this programme of work. Obviously, with talking about mental health and with transforming our community services for something so wide and vast, there are a large number of partners who are working on this programme with us. They include North Staffordshire Combined Healthcare, NHS Trust, the trust that I work in, Midlands Partnership NHS Foundation Trust, who also operate community mental health services in Staffordshire and Stoke-on-Trent, Stoke-on-Trent City Council, the local authority for the city, Staffordshire County Council, and an alliance from the voluntary sector who are working hand in hand with us to deliver this programme. We're also working importantly with our GP colleagues and our primary care services in the form of primary care networks, which are groups of GP practices who are working together in a more formal way than they previously have done. So there are 3 key clinical components of the programme that we're operating from an NHS perspective. They are adult eating disorders, personality disorder, and rehabilitation services for patients who've had severe mental illness.
It's about really taking the services to a local level, supporting the health needs of that local population, doing a lot of work around prevention, focusing on the strengths of the individual, and really ensuring that we're delivering an individualised, personalised package of services, not just care and health, but also services to support that person and their families to live well in a local community. Historically, people that have had a diagnosis of a personality disorder have often been excluded from services because they either don't meet the thresholds for care, both in a primary care setting, particularly around our improving access to psychological therapy services. The whole ethos of this transformation is about looking at that person as a whole. So what are all the things that are impacting on that individual's ability to live a fulfilled and healthy life from a mental health perspective, but also a physical health perspective, and actually work with them as a collective group of people around one care plan, so supporting all of those needs, not passing them from service to service, but actually working as a collective within that community with those individuals. What currently happens for people is that generally, people have more than one problem. So you could be presenting with, quite a significant depression and also have some issues with eating, which may require support from a specialised eating disorders service. What currently happens is that you would be seen in 2 different services. You would be passed between those services for your care, and actually what this future model is really pushing us to think about is, regardless of what your needs are as an individual, that within a local community around the primary care networks, we will wrap services around that person. All of those services will be delivered from a local level. There'll be one care plan that's owned by the person, that everybody that needs to input into that care plan will provide that support at a very local level. The ultimate goal is really to support and enable people to live a fulfilled life within their local communities, to get to a point of recovery so that actually they are able to live a life that most of us would want to live within a local community setting, have have the support they need when they need it, and also be able to contribute to that community.
So the voluntary sector has a key role here in recognising the holistic nature of somebody who's experiencing severe mental illness. So yes, they will need therapies and medication, but it's also all of the things around them. So their housing situation, their employment situation, skills, education, friends, family support, things to get up for in the morning, things to dream about and aspire to. And the voluntary sector has a key role to play in that, because they are often the ones that are providing those opportunities and providing that support. So for that individual to be aware of and able to access all of the different possible things out there in the voluntary and community sector can be a really key and important part of their recovery. So in particular, the voluntary sector operates in and is often really good at providing support for things like housing support, homelessness support if people actually are out on the streets, drug and alcohol support, which often is needed alongside mental health support, also things to do with social isolation, tackling loneliness, making sure that people have got connections and build friendships and relationships within their community. But it can be, almost as broad and as wide as you can imagine, really, because people who suffer from severe mental illness are just the same as ordinary people. They've got such a wide range of interests and ambitions and things they want to do in life, and being able to get the support so that they can still fulfil those areas of their ambition and things they want to do in their own lives is really important to helping them with their recovery.